QSIR was a methodology that the Trust had decided to adopt based on some evaluations that were done on other quality improvement methodologies.
You could see the promulgation of people using QSIR across the country, so we looked at it and thought actually that would give us a really good community to be part of.
We knew this had the right resources and tools, and this would fit nicely with where we were at our quality improvement journey. If we were to truly embed this within the organisation, then we needed to make no assumptions based on anyone's job title.
What we decided to do was to actually start training the very senior people of the organisation first.
Managers can only be supportive if they actually understand what the circumstances are that people are working in, what support they need.
Hi Glenn, nice to meet you.
At least once a month I spend a morning or a whole shift, usually in a clinical area. I get my support worker uniform on, make sure that I make beds and feed people and look after them, and I just find it's a great way of spending real time both with patients and also with staff right at the very front line. It is a deliberate strategy to try and improve the engagement of managers, directors, the board with people throughout the organisation.
Fundamentals Day was good fun. I think it built a level of camaraderie within the smaller groups that were set up. There was a good mix of staff, both clinical and non-clinical, at different levels of seniority. One of my fellow non-executives was on the course as well.
Doing the training with him, it doesn't feel that he's the chairman, he's like also a member of the team, and it was really good. Everyone was at ease, the teamwork, all the opinions of others matters, he listened, so it was a really good day for all of us.
It's part of my role and the other non-executives to get a level of assurance about the improving performance of the Trust. So I think going on the course gives me an understanding of the tools that are being used within the Trust to move things forward. There were elements of that day that I think were quite powerful for board members.
Is a better way to move from the good idea stage.
Starting point for us as a trust was to say that everybody was at the start of that journey. So it was a very simple decision to say that our executive team and our trust board members were on our first cohort.
As part of the QSIR process, everyone has to have a project. Part of the training is working through the stages of the project in terms of beginning to specify it and coming out with an implementation plan as part of that process. And when we did our first cohort, which was to the execs and senior leaders, we made sure that they were no different and they had to work on a QSIR project as part of that in small groups. Probably one of the most impactful projects we've run is one that a small group, including our nursing director, started, which we all came up with names for them. This was called Project Kit Kat, and that was really based around making sure that staff take a break. I think staff really enjoy and really appreciate the fact that we are thinking about their well-being and their hydration and their ability to take just a little bit of downtime. The staff in some of these areas are working really flat out, and to support them to think about those things and to be able to do them is really important to us as a trust. And it was great to see that flourish and work really well in the run-up to Christmas.
When it comes to prostate cancer patients, it usually reaches a point in which the cancer spreads to the bones. At that point, nuclear medicine offers a treatment called radium-223 that helps to fight the disease, but it is recommended that patients also have a bone-strengthening medication infusion at the same time. And up to now, they were coming to hospital in 2 different occasions and being seen by 2 different teams on different days, and the process was quite complicated. So when we had opportunity to bring a project to QSIR, we thought maybe we can improve this one and make the journey for the patient much easier. So we decided to create a one-stop clinic in which patients would come to the nuclear medicine department, and the nuclear medicine team would do both procedures, one after the other, and hopefully that would improve the overall patient experience.
How are you doing today?
So we use methodologies and tools like the PDSA, RAMP, and the project mapping and process mapping. And then we engage with stakeholders and we propose the changes. From that point on, it was to rethink the use of resources, to think critically about how we could improve the journey, and then to test it. How is that feeling? So this resulted in an improvement in the workflow, basically because we managed to reduce the waiting times, to avoid duplication, to minimize the number of invasive procedures, so the patients will only have one cannula, will only have one set of blood tests, and it will also promote the continuity of care, so they will be managed by the same team through the whole process of care.
Okay. One of the things about QSIR that attracted us from the beginning was the ability to make the training really sustainable in the organisation by having our own staff, as they become more confident with the methods, actually training to be faculty themselves, going off to the QSIR college and then teaching their colleagues in how to use these methods.
From cohort 1, we actually had 6 staff who are actually undertaking their QSIR college training at the moment, and 3 of those are our executive members.
Both myself, the medical director and our director of strategy are going through the QSIR college process literally at the moment. So at the moment I don't know whether I'm successful or not, but I'm in that process at the moment, but it's something that we feel really passionate about.
This means that our executive members will actually be delivering the training to staff at all levels within the organisation, and will be making a commitment of a minimum 2 days a month to deliver that training. They're not just talking about it, they're actually doing it. And actually by doing it, they're actually telling the workforce that it's really important to us. It's really important to us as a trust to create that culture of continuous improvements.
Colour, not the word.
Can I go backwards?
Yes.
MTW have chosen this methodology, but equally so our community partners and mental health trust partners have as well. So we're in a position where we're about to launch some collaborative training. So when we're working on our system-wide transformation programmes, we're all talking the same language, we all understand the methodologies and the tools and resources.
Good effort.
Our plan for QSIR is to ensure that it's the primary method or collection of methods that people use when they are planning change and improvement.
We've managed to weave all of the tools and techniques into our business planning going forward. We also have made a conscious decision to say that staff at a certain level, this would become mandatory training for them. And we're actually in the process of changing all our job descriptions to include that in the personal specifications.
As the SRO, I get to give out the certificates at the end, and it's really great to see the real diversity of staff, but also how excited and positive they are. There's a real enthusiasm that builds around it.
QSIR has empowered me not only to be part of the changes in the hospital, but to lead transformation projects. So I have now the tools that I was lacking, or that I needed to develop to actually structure my improvement ideas.
Already we're actually seeing positive improvements for our patient experience and outcomes. Some of the initiatives that we've undertaken have seen a reduction in our length of stay. So we are getting our patients home in a timely fashion. And also from a staff experience point of view, we know that our project that was called Project KitKat actually saw a huge improvement to our staff survey response rates. Last year we were at 33% and we managed to achieve a 51% response rate, which is something that we're incredibly proud of.
A very important part is that I realised that we can seek actively guidance and advice from our executive team. They are there for us, and when we have a problem or we are struggling with a specific issue, they will have our back, so we can, rely on them and we can count on them.